Indiana, state health experts report one human confirmed case of West Nile virus in the state. More are expected as mosquitoes have tested positive for that virus in Benton, Hamilton, and Jennings counties. West Nile can cause fever, headache, and rash. And it's just one of the infectious diseases that are more prevalent in the summertime. Dr. Haley Trambaugh from Hendricks Regional Health joins us with what she's seeing in her practice and also some prevention steps that you should be taking right now. So thank you so much for joining us.
Yes, thank you.
So tell me, what are you seeing in your office right now as the summer season's underway?
We have been seeing a fair amount of hand, foot, mouth disease. It's a viral illness. It's most prevalent in children under 5. It can be seen in adults. It's typically a more mild illness in adults, but mostly we see it in children. It presents with fever and irritability for the first 24 hours. A lot of times parents aren't quite sure what's happening in the first day of illness. And then within 24 to 48 hours, usually the child will break out in the classic rash.
So we're looking at images of that rash right now. Boy, it looks like that could be an allergic reaction, or maybe you even think the first image looked like it could be chickenpox. Are people often surprised to hear what in fact the diagnosis is?
Absolutely, yeah. A lot of people are not aware of the illness. The classic presentation is a rash on the hands and the feet, which is actually a very interesting rash. Most do not present on the palms and soles. So that's typically, for a doctor, what helps us to make that diagnosis is if children have the lesions on their hands and their feet.
What are some things that we can do to prevent getting hand, foot, and mouth, some of the prevention steps?
Absolutely. Prevention is very important because there's not a vaccine and there's no specific treatment with it being a virus. So hand washing is extremely important, and staying home from work, school, and daycare if you are ill is extremely important.
Yeah, boy, that rash looks like something no one would want to get.
It's not pleasant.
All right, well, let's move on now to another issue that you're saying you're seeing in your office right now, Lyme disease. Tell us about that.
Absolutely, yes. I've seen a few cases of Lyme disease this year. I assume more will come. It's a tick-borne illness, so it's passed to humans from ticks. It's bacterial. So the good news with the bacterial illness is we can treat it with antibiotics if it's properly diagnosed.
But the key for that, of course, is prevention then, if there's no cure.
Absolutely. It comes with a classic rash, too, that looks like a bullseye. And prevention for tick-borne illnesses would be wearing long sleeves, pants when you go into the woods, doing a tick check when you get back out of the woods, and wearing insect repellent.
And how do you test for Lyme disease? How do you confirm that?
Blood test. There's a blood test that we can do for Lyme disease. The rash in and of itself is diagnostic, so you don't have to have the blood work if you have the classic rash, but sometimes people don't have that, so we do have blood work available.
And we earlier were talking about West Nile virus. Tell us about that.
Absolutely, yes. So West Nile is something we've had here for several years, but is becoming more prevalent. Presents with fever, headache, joint pain, sometimes rash, and can become very serious. We also have no specific treatment or vaccine for it. So again, we come back to the prevention.
All right, Dr. Haley Trambaugh from Hendricks, thank you so much for joining us today. And boy, you just think a little mosquito bite, boy, that itches, but it could be so much more.
Absolutely.